Good evening from New York. I'm Chris Hayes. Over the last 5 days, from when the president first announced he had COVID to when he was hospitalized at Walter Reed, scarily, with what appears to be a severe case, to when he returned to the White House despite still being infected and likely contagious, and then took off his mask and entered the building. Every single venal pathology of this president, this administration, and the party that supports him that have led to one of the worst responses of the world and the deaths of more than 211,000 Americans and counting, all of them have been on display. The denials and the shiftiness and the lies, the propaganda and the narcissism, the disinformation and misinformation and miscommunication, the subsuming everything to the president's narrow sense of what will play best politically, the contempt for safety precautions and public health expertise. But more than anything else, it's the recklessness. A recklessness so egregious and aggressive and acute as to only be described as evil. What we know, and what we don't know the full story, is that someone in the president's inner circle tested positive for COVID on Thursday. The president then went to a lunch buffet fundraiser, potentially infecting all kinds of other people, including the attendees and the staff of his own resort. New Jersey officials have been frantically working to contact the guests and try to control the spread. And then, during the president's hospitalization for the coronavirus, he insisted on a joyride for pure propaganda and ego purposes, locking Secret Service agents into a hermetically sealed car with him, despite his ongoing sickness. And then he returned to the White House, still sick, where he theatrically took off his mask and entered the building to infect even more people. This behavior, which reflects the attitude that he and the White House have been taking 4 months now, I mean, really, honestly, from the beginning of the pandemic, has produced an outbreak in the White House with more confirmed cases than there are in entire countries right now. Just a short time ago, a senior administration official told NBC News that senior advisor to the president, Stephen Miller, has now tested positive and is in quarantine. And consider the sheer size of the cluster that Miller is now part of. At least 25 people, among them the president, his wife, Hope Hicks, Stephen Miller, Trump's campaign manager, a number of Republican senators, Chris Christie, Kellyanne Conway, and her daughter, Claudia, Kayleigh McEnany, and at least 4 press staffers, people that work for her, at least 3 White House reporters who have to go and interact with them as they bark at them without masks, including Michael Shear of the New York Times, whose wife now has been infected. That's not to mention Trump's personal valet, a Coast Guard admiral whose infection prompted the Joint Chiefs to quarantine. That is what this White House's cavalier attitude toward the virus has wrought. And these are only the people we've been able to publicly identify, often through diligent reporting. The administration's not doing it themselves. No, they are not contact tracing, despite the CDC standing by to do so. They are not even contacting people who they know have been exposed. All of that would seem to be in furtherance of a cover-up of the magnitude of their stupidity and incompetence and cruelty, even if the cover-up now further imperils people's health. Meanwhile, the person running against Trump is taking the opposite tack. Joe Biden, in a speech today at Gettysburg, Pennsylvania, embracing just basic science, prudence, and safety.
Let's end the politics and follow the science. Wearing a mask is not a political statement. It's a scientific recommendation. Social distancing isn't a political statement. It's a scientific recommendation. Testing, tracing, the development and ultimate approval and distribution of a vaccine isn't a political statement. It is a science-based decision.
It would be one thing if the president was just being personally irresponsible, still awful, still putting people around him at terrible risk. But at least that would be somewhat contained, I suppose. But no, after getting the best health care the taxpayer dollars can buy, a 4-room suite at Walter Reed and Medevac and access to the best medicine, and he's the president, that comes with the territory, and a team of doctors monitoring every up and down and setting up ways to treat him back at home. He comes back to tell everyone not to worry about COVID, indeed, to basically pitch it as if he's hawking a vitamin supplement.
And you're going to beat it. I didn't feel so good. And 2 days ago, I could have left 2 days ago. 2 days ago, I felt great, like better than I have in a long time. I said just recently, better than 20 years ago.
That's the kind of message that will get people sick. And when people get sick, they die. I mean, statements like that don't just encourage people not to worry about a virus that might very well kill them, particularly if they are in his age group. They devalue and denigrate the loss of so many of our fellow Americans to this virus. After Trump tweeted something similar yesterday, telling people not to be afraid of the disease, no big deal, U.S. Olympic runner Kara Goucher responded, "As my grandfather lies in a bed, struggling to take his last breaths due to COVID, I'm not sure I've ever read anything more offensive or tone-deaf in my life." We lost an average of more than 700 Americans every day to the virus over just the past week, 7 months into this. Over the course of this pandemic, thousands of Americans have died alone at home because the hospitals were so overrun. They stayed home until it was too late. And then some were found by family members or concerned neighbors. And there are hospitals, as I speak to you right now, that are capacity in Wisconsin, which has an outbreak right now. And yet this president, who got the best care in the world on the public dollar that he paid all of $750 in taxes for, has the gall to tell the rest of us not to worry.